Today we'll be discussing the case of Louis Washkansky. It's December 1967. Louis is at the hospital, in bed, absolutely sick. He had been in the hospital for 3 months by this point, and each day his condition just continued to get worse. For years, Louis had been suffering with heart failure, and with how bad his heart was looking, doctors knew they didn't have a lot of time left before Louis truthfully would be gone. He saw multiple doctors, did various medications. At some point, he was even on 15 pills a day. But despite doing all of this, nothing was working. Doctors didn't know what to do, and it was finally after one doctor had proposed an idea when they soon realized that there might just be one last thing they could do that could actually save Louis's life. This doctor proposed that they should perform surgery on Louis's heart, as they'd done many times before. Thing is, this wasn't going to be just any surgery. In fact, this surgery was rather going to be a very serious gamble, because this very doctor had the idea to do what many would consider the impossible, to perform the world's first ever human-to-human heart transplant on Louis. Doctors, skeptics, the entire medical community, everyone questioned if this was going to work, and to the world's surprise, it was a success. But while things seemed to be going just fine at first, it wasn't too long after when everything started going horribly wrong. Even though Louis's new heart was actually healthy, his condition was rapidly deteriorating. There was something horrifically wrong happening inside of his body, and for days, doctors didn't know what was going on. Doctors, again, were in a race against the clock, and after the decisions they would make, many would question if what the doctors had done was even worth it, or if it was even ethical. This case would go down as a revolutionary moment in medical history, and you'll be shocked to see the hurdles and outcome of one of the most bold attempts at a surgery one could have ever imagined. But before we get into this case, just to introduce myself, my name is Petal Palmer, and on this channel I post anything medical, mysteries, and crime. If that is something that sounds interesting to you, please consider subscribing if you end up liking this video. All right, let's get into this case. Louis Joshua Washkansky was born on April 12, 1912 to parents Abe Washkansky and Chana Yentel Kelmogor in Kovno, Lithuania, now known as Kaunas. He was the youngest of a total of 4 siblings, with 2 sisters, Annie and Leah, and a brother, Tevye. It was only 3 months after Louis was born when his father, Abe, moved away from their home in Kovno to begin setting up a new life for the family in the city of Cape Town, located in the province of Cape, now known as Western Cape, in South Africa. In Cape Town, Abe began a business by opening up a grocery store. This store became very popular in the town, and the Washkanskys had the hope that eventually the whole family would be able to come over to join him in Cape Town. This, however, would not be the case, because only a couple years later, in July 1914, World War I would begin, and Chana and the children would not be able to move to Cape Town to meet Abe as they'd originally planned. As the several years went by in Kovno, Louis's mother worked at her own small store, and she often finished so late in the day. With him being the youngest, Louis's siblings described they used to take good care of him. It was finally in 1922, when Louis was 9 years old, when the family was able to make the move to Cape Town to be reunited with his father. And from that point on, Louis's life was pretty normal. He went to Cape Town High School. He even began working with his father's grocery business after graduation. And even in the 1940s, during World War II, Louis enlisted in the South African military as part of the engineering branch, and he saw active service in East Africa, North Africa, and even Italy. Some point after the war, Louis met a woman named Anne. They quickly fell in love, got married, and Louis would become the stepfather to Anne's son Michael, who had lost his biological father as a teenager. Louis was described as being an extremely hard worker. No matter what the circumstances were, he would always work, and he never wanted those around him to worry about him, even if he was struggling with something. This was something his good friend and brother-in-law, Solly Sklar, described as, quote, courageous, but with a soft heart. Overall, Louis lived an active life. He would partake in soccer, he would swim, he would weightlift. He was a pretty healthy person, and he seemed to be doing just fine. It was, however, around the early 1960s when his health would abruptly take a turn for the worse. Louis was diagnosed with both diabetes and ischemic heart disease, which is also known as coronary artery disease or coronary heart disease. According to the National Heart, Lung, and Blood Institute, this, quote, is a type of heart disease where the arteries of the heart cannot deliver enough oxygen-rich blood to the heart. But even with these diagnoses, this was only the start of the many problems Louis would have regarding his heart. In December 1960, Louis suffered a heart attack, but this wouldn't be the only time he would have one. In fact, he would go on to have many more heart attacks until there was one in particular that would cause damage so serious he would soon be diagnosed with another issue. Sometime in 1965, Louis was at work speaking with a customer when suddenly he just felt a heart attack coming on. He, of course, experienced them before, so he knew when they were coming on, and he told the customer, like, hey, I need to see a doctor as soon as possible. The storekeeper was also there, and when they heard this, they were like, hey, there's a doctor nearby, let me go get them. They went to find the doctor, but unfortunately, they weren't there at the time. So they got in the car, and for an entire hour, they drove around just trying to find a doctor. Finally, after the hour passed, they got to the Rondebosch Cottage Hospital. But when they arrived, Louis didn't let them carry him in or anything. He instead walked up the stairs to get inside the hospital. He made it successfully to the top of the stairs. But as soon as he reached the top, he collapsed in severe failure. His doctor, Kaplan, would later describe, quote, this destroyed most of his left ventricle, because now, in addition to the ischemic heart disease, Louis now had heart failure. With a heart attack, it's typically recommended that patients take it easy for the first few weeks or even months as they recover. But even with this, Louis still wanted to always move. He never stayed in bed for longer than 2 hours in the day to rest. He would even go on the road to either drive to customers or take telephone calls. And when people would question this, he would regularly tell people, quote, this is no life to stay in bed already. And while he stayed relatively active, eventually his condition would get worse. In April 1966, Louis and his wife Anne had gone to the Groote Schuur Hospital in Cape Town to see a physician as Louis began having troubles with his breathing. When they got to the hospital, they were greeted by Dr. Kaplan, and when Louis told him about the difficulty breathing, Louis thought that this issue was caused by his lungs. But after evaluating him, Dr. Kaplan had a different diagnosis. He told Louis that his breathing issue was from something called Cheyne-stokes respiration, and he explained that the cause of this was because of the gross heart failure. Dr. Kaplan described Cheyne-stokes saying, quote, it's rather terrifying to witness. The patient takes a short breath, then a deeper one, then a still deeper one, going on like that until he stops breathing altogether, lying there with no sign of respiration. Dr. Kaplan went on to give Louis a prescription for aminophylline suppositories intended to be inserted through his rectum with the goal of allowing him to breathe more normally. And Louis was actually very excited and looking forward to the pills helping. But even with this, Dr. Kaplan didn't have a great prognosis for Louis. He thought that he had just about less than 2 months to go, and he truly admired what he described as Louis' quote, will to live. And it would be just 2 months later when Louis would return back to the hospital in June, but this time with both the troubled breathing and now a cough. Because of this, Dr. Kaplan increased the dose of his diuretics, and eventually he would have Louis on a total of 15 pills daily. But it would be when Louis returned to the hospital 3 months later in September 1966 when his condition was much worse. Louis now had swelling in both his legs and his liver. And to Dr. Kaplan, this wasn't a good sign because from the start, the issue was always the left ventricle failing. But this now indicated to him that his right ventricle was failing as well. Just to explain, your heart is made up of 4 chambers. The 2 at the top are called your right atrium and left atrium, and the 2 at the bottom are called your right ventricle and left ventricle. 2/3 of Louis' left ventricle had died. In fact, his left ventricle got so swollen to the point it barely pumped out blood. And now with swelling, this showed that the disease was not just affecting his heart or chest, but it was effectively destroying the rest of his body. Even though the diabetes was also worsening, with how Louis was looking, Dr. Kaplan thought it would be best at that point to not be so strict about his diet or even medications, stating, quote, his diabetes also became worse, but since I knew he had not much hope to live, I saw little point in getting heroic about the diabetes. It seemed heartless to further restrict his diet or add more pills. Louis would go on to continue living his normal life. He was working his wholesale business, taking orders, and driving around Cape Town to his customers. And his customers admired him and his drive so much, they stayed very loyal to him. He continued going to soccer games every Friday night. He went to parties. He would even enjoy a few drinks. But despite being able to continue living life as normal as possible, Louis's condition was still getting worse. He began experiencing more chest pains. He was having fainting attacks. He had respiratory failure, and at some point, he even started spitting up blood. Dr. Kaplan tried everything he could to help Louis out, but he was not getting any better. So in July 1967, he decided to send Louis to the cardiac clinic to have other specialists see him and try seeing what they could do. But even after sending him to the cardiac clinic where they performed angiograms and other testing, Louis was still sent back to Dr. Kaplan with them telling him that there was nothing that could be done. And it would be just 2 months later, in September 1967, Louis would be admitted to the hospital in even worse condition. Kind of like the previous year when he suffered his biggest heart attack and still walked up the stairs. During this day, they just wanted Louis to rest. And at that point, it wasn't a matter of if he was going to pass away, but rather when would it happen. Just the next month in late October, Louis would actually suffer a diabetic coma. And after what Dr. Kaplan described as a, quote, little stroke, Louis developed something called hemiballismus, a condition which caused his hand to shake whenever he moved it. Louis would eventually develop edema or fluid retention in his legs. And because of this, for 5 days and 5 nights, they made him sit upright in a chair with his feet in basins to physically draw out the fluid with needles and cannulas called Southey tubes. When they were used, at least in the case of Louis, they were extremely painful. And it wasn't just this, because Louis also developed cellulitis, a bacterial infection of the skin in his left calf after the insertion of the Southey tubes. So now, in addition to the heart problems, liver failure, kidney failure, and even diabetes, he now had this painful infection. Louis had a tendency to kind of minimize how he was feeling whenever he described his condition to his wife Anne, as she was extremely worried about him. For the past few months before he was in the hospital, she was losing sleep at night, constantly listening to his breathing to make sure he wasn't going to just pass away. And because Louis saw how stressed out she was regarding his health, he would regularly sugarcoat and hide how he was feeling just so he wouldn't stress her out any further. And it was only during this stay in the hospital, when they placed him on what Anne described as, quote, the danger list, when Anne was able to realize Louis truly was dying. And for 2 months straight, Anne was watching his condition deteriorate on a daily basis. Even still with this happening, he never complained about his condition, and the literal only complaint he had in the hospital was regarding the food. It was in early November when Dr. Kaplan was approached by Professor and Chief of Cardiology at the hospital, Dr. Velva, or Vel, Schreier. And it would be during this meeting when Dr. Schreier would tell him, look, we have an idea of how we can help Louis. We're thinking we could transplant a heart into him. Dr. Kaplan was a bit taken back by this, as he'd never thought of this as an idea. But after Dr. Schreier asked him how he thought Louis would react to it, Dr. Kaplan was like, yeah, Louis is honestly down for anything. I think he would accept it just fine. It was at that point, Dr. Schreier told Dr. Kaplan, that's great. I think you should talk to him about it. And Dr. Kaplan did just that. He wasted no time, walked right out of the clinic, straight to the basement in the A1 ward where Louis was, and he proposed the idea of a heart transplant to him. When Dr. Kaplan walked into Louis's room, Louis was lying in bed with his swollen feet dangling on the side and with a cigarette in hand. And Dr. Kaplan told him, look, Louis, there's something we might be able to do here for you. But before I tell you, I just want you to know it's a very serious gamble, and if we do it, there's a possibility you may or may not come out alive. So Louis perched up in his bed and was like, okay, tell me, what is it? And Dr. Kaplan told him, we might be able to transplant someone's heart into your body. This in itself was very serious because a human-to-human heart transplant had never been done before. But very shortly after telling him this, Louis was like, okay, I mean, if that's what we have to do, then we'll just have to do it. Being the person he was, Dr. Kaplan fully expected this response, but he just wanted Louis to understand the severity of a procedure like this. So he told him, look, I haven't been able to read up on this yet. And he asked him, like, don't you want to talk to Anne about it? But Louis told him, no, he already made up his mind and stayed firm that regardless of the outcome, this is what he wanted to do. And with the rate of how his health was moving anyway, he was willing to take the chance. While doing this would have been the first of its kind, there was an extensive history of prior research and experiments specifically on animals to figure out the possibility of conducting a human-to-human heart transplant. In 1905, doctors Charles Guthrie and Alexis Carroll at the University of Chicago performed the world's first recorded heterotopic heart transplant in a dog. And although there were several physiological issues with the transplant, this experiment was able to show that heart transplants were in fact possible. With heterotopic transplants, this refers to the donor's organ being placed alongside the recipient's organ so that they're both connected inside the recipient. Orthotopic transplant, on the other hand, refer to when the recipient's organ is fully removed and the donor's organ completely replaces the recipient's in the correct anatomical position. Orthotopic heart transplants are more common and preferred if the patient meets the criteria for them. But heterotopic transplants do still happen and could possibly be more effective in certain cases. It just truly is case dependent. Research of heart transplants involving dogs, amongst other species, went on for several more decades. This especially included the work of organ transplant pioneer Vladimir Demikov of Russia, who was actually responsible for various breakthroughs and firsts regarding transplants, even including the two-headed dog experiment. This, in other words, were head transplants performed on dogs, where one dog's head was taken and attached to another dog's body, while both of their heads remained in the body at the same time. The longest survival time following these experiments was 29 days. And while undoubtedly bizarre, these experiments helped Demikov show the extent of possibilities that could be achieved through transplant surgery. Scientists were able to see the success they got with heart transplants in animals. It was only a matter of time for them to see success in humans, because it was finally on January 24th, 1964, when the world's first heart transplant of a human would technically occur. This heart transplant was performed by Dr. James D. Hardy. The recipient was 68-year-old upholsterer Boyd Rush at the University of Mississippi. But it wasn't just any transplant with the heart of a human donor, because it was instead a transplant with the heart of a chimpanzee. After using a defibrillator, the heart actually worked for half an hour. And then after using a pacemaker, the heart worked for an additional half hour. But this actually wouldn't last too long because Boyd would unfortunately pass away that same day without waking up after the surgery. While the incident with Boyd rightfully was discouraging, it also created a drive for researchers and medical professionals to continue trying to get to the bottom of successful heart transplants. Various surgeons were eager to be the first to perform this heart transplant. More specifically, there was a 4-team race actively trying to make this happen. This race was between Doctors Richard Lauer in Virginia, Adrian Kantrowitz in New York, and what many considered to be leading the race, Norman Shumway at Stanford. But there was one more person who too was very ambitious and very eager to get this done. And his name was Dr. Christiaan Barnard, a cardiothoracic surgeon in South Africa. Christiaan Barnard was born on November 8, 1922 to parents Adam Hendrik Barnard and Maria Elizabeth de Sewert in the town of Beaufort West, located in the semi-desert region of the Karoo in Western Cape, South Africa. He was one of 5 brothers, but one of his brothers, Abraham, passed away at the age of 5 of heart disease. Many would speculate that it was this happening in part that would inspire him to become a cardiothoracic surgeon. This isn't confirmed anywhere, but what is confirmed is that Barnard, whose mother played the organ, stated that it was her playing this instrument, which he believes could have subconsciously sparked his interest in the pump, referring to the heart. And he also later on stated, quote, "The reason I became a doctor was to make money, which unfortunately I've never been able to achieve." Barnard grew up in a poor family, but nonetheless, his parents always encouraged him and his brothers, and his mom specifically instilled to them that they can accomplish and find success in anything they set their minds to, which you'll see Barnard and even his brothers definitely ended up doing. He studied at the University of Cape Town Medical School after graduating high school in 1940. Just a few years after that, in 1946, he graduated with his MBCHB degree, which is a Bachelor of Medicine, Bachelor of Surgery degree, and after this, his medical career truly started to begin. After 6 years of medical training, doctors in South Africa were required to do a 1-year medical internship at a hospital. Dr. Barnard did his internship at the Groote Schuur Hospital in Cape Town, and after completing that and taking years to work as a general practitioner in a rural town called Ceres, he would return to work at that very hospital in 1951. When he first returned to Groote Schuur, Dr. Barnard worked as both a senior resident medical officer as well as a registrar for the Department of Medicine, and it was there where he continued his postgraduate studies. In 1953, he completed and earned a Master's of Medicine, and he also earned a Doctorate of Medicine, and this allowed him to get to work on what many surgeons in the 1950s had already been doing, which was experimenting, especially on dogs, to figure out new surgical treatments to various diseases. He was very successful in a lot of the experiments he was doing. In a time span of only 9 months, and after around 40 attempts experimenting on dogs, Dr. Barnard was able to develop a surgery that was successful in saving the lives of babies with a birth defect known as intestinal atresia. This is a congenital condition in which a developing fetus's intestines don't form properly, which ends up causing a blockage in the bowels. And he would continue to establish himself as an important voice in the medical community as he continued his journey to becoming a cardiothoracic surgeon. Dr. Barnard earned a scholarship to study abroad for 2 years in the United States. And so in December 1955, he ended up traveling to Minneapolis to the University of Minnesota to continue his doctoral studies, working with several very notable physicians at the time. And while there, he did in fact accomplish some pretty significant things. In 1956, he was actually able to experience using a heart-lung machine for the first time. This is also referred to as a cardiopulmonary bypass machine, or the pump. Being on bypass is a term that's used to describe somebody being on a heart-lung or cardiopulmonary bypass machine. And its purpose is to temporarily take over the work of the heart or lungs so that in cases such as cardiac surgery, for example, the blood bypasses or avoids the heart and lungs, allowing the team to perform the procedure without blood being in the way. These machines have many different components, but notably the pump is the component that acts like the heart to send blood to the body, the oxygenator is the component that acts like the lungs, and the heat exchanger is the component that controls the temperature of the blood through heating or cooling. Regarding the oxygenator, there are different kinds of oxygenators with different functions. But while at the University of Minnesota, Dr. Barnard was actually able to utilize the first ever bubble oxygenator created in May 1955 at the university called the Dual Lilly-High Bubble Oxygenator. And this machine was a game changer for operations at the university. Within just those few months of it being created, they were able to do about 40 open heart surgeries, which was a procedure that had only been successfully done for the first time 2 years prior in May 1953. And Dr. Barnard was absolutely fascinated operated by this machine. Over at Groote Schuur, they didn't have equipment like they did at the surgical research lab over at the University of Minnesota. Working with this machine taught him how valuable this machine could be in procedures at home. And eventually, when he would return to South Africa, he would actually bring this machine back with him, allowing Groote Schuur to become the first hospital in Africa where open heart surgery was able to be performed with cardiac bypass. While in Minneapolis in 1956, Dr. Barnard was diagnosed with rheumatoid arthritis. For a profession where you are constantly on your feet and working with your hands, having this diagnosis was something Dr. Barnard had to get adjusted to. But fortunately for him, with treatment and with rheumatoid arthritis being a disease with different progression rates, the symptoms he experienced were actually never too bad to the point where it affected him from doing his job effectively. And even whenever he did have a flare-up, he often recovered quickly and would sometimes not even get another flare-up until months later. It was just a couple years later, in 1958, when Dr. Barnard went on to earn both a Master's of Science in Surgery and a PhD for his research. This allowed him to officially become a cardiothoracic surgeon. And after this, he would return to the Groote Schuur Hospital in Cape Town, South Africa, where he was made the department head for the Department of Experimental Surgery, while also working as a lecturer at the University of Cape Town. But yes, in a total of 18 years, Dr. Barnard earned an MBCHB degree, an MMed, MD, another master's, and a PhD from 1940 to 1958. As mentioned, many doctors at the time from all around the world were conducting many experiments on dogs to try to come up with an effective human-to-human heart transplant method. And Dr. Barnard was one of those doctors as well. When Dr. Barnard was at the University of Minnesota in 1956, he actually worked alongside one of these surgeons, Dr. Norman Shumway. In 1958, Dr. Shumway started a new position at Stanford where he further crafted his work in heart transplants. It was there where he, alongside the other heart transplant pioneer, Dr. Richard Lauer, worked together, coming up with major breakthroughs in the method of heart transplants in dogs. For the next several years, with Dr. Shumway still working at Stanford and Dr. Lauer working at the Medical College of Virginia, they developed a technique that was essentially used as the blueprint in the experiments Dr. Barnard continued to do, just with a few tweaks. Dr. Barnard and his team got the actual surgical technique down pat. However, he still needed some more training to figure out how to make sure the body didn't reject the heart. Because of this, he applied for a 3-month training course under Dr. David Hume, who at the time was working at the Medical College of Virginia. And after being accepted, Dr. Barnard headed back to the States in August 1966. It was there where he observed the techniques of Dr. David Hume and even of Dr. Richard Lauer, who also worked at the medical school. While Drs. Shumway and Lauer had experimented with heart transplants on well over 300 dogs with long survival rates, Dr. Barnard had only experimented on 48 dogs by that point, and his survival rates weren't that great. Drs. Lauer and Shumway had both nearly been able to perform this heart transplant, but each time there were last-minute issues with donor and recipient compatibility. And over in New York in June of 1966, Dr. Adrian Kantrowitz had actually reached the operating room with both the donor and recipient. But at the last second, he didn't proceed after his team had ethical concerns regarding using a brain-dead infant as a donor. In the States, there were strict laws regarding the notion of brain death, but these laws weren't present in South Africa. So, after being able to further train and observe all the techniques over those 3 months in Virginia, Dr. Barnard was determined that once he returned to South Africa, he would perform the world's first human-to-human heart transplant. On a regular basis, especially during the last 2 weeks of October 1967, he would bother Dr. Schreier, just constantly asking if he would be able to do a transplant on a patient who needed it. In fact, he was so anxious about this possible transplant being delayed, the arthritis he had began flaring up pretty badly in both his hands and feet. And this worried him that when or if the time came, the pain would be too bad for him to even perform the operation. Dr. Barnard reasoned, saying that whoever receives the heart transplant would be approaching death anyway, so truthfully, giving them the transplant would be their only chance. Despite this reasoning though, Dr. Schreier believed that there wasn't enough research that was effective at the time to be able to do this, and he thought that attempting this could be irresponsible, especially for the hospital's reputation. Dr. Schreier had a reputation around the world as an authoritative figure in cardiology and sciences. He was extremely successful, he had a lot of experience, and he played an important role making decisions in the hospital regarding cardiac procedures. He was someone Dr. Barnard even cited as, quote, stimulating his interest in heart surgery. Doing something like this would be extremely bold of the hospital, especially as Dr. Schreier reasoned that even the dogs Dr. Barnard experimented on, they hadn't really lived that long themselves. So if they were to mess this up on a human, it would have likely been a big deal. Dr. Schreier told Dr. Barnard that he'd think about it. And after waiting some time, it was finally on November 10th, 1967, when Dr. Schreier approached Dr. Barnard and told him that they finally have a candidate for a heart transplant. And this very candidate was named Louis Washkansky. As Dr. Schreier was discussing this with Dr. Barnard, he was like, hey, I don't know if you remember, but you actually reviewed this patient's case in July. And during that time, you and the team said nothing could be done and rejected doing a cardiac surgery. After hearing this, Dr. Barnard started thinking, and he figured that the case must have been so bad at the time that even a cardiac surgery seemed useless. Dr. Barnard and Dr. Schreier went on to examine Louis' folder. On a projector, they looked at Louis' angiograms, something Dr. Barnard described as, quote, movies of the heart, and they reviewed the film studies of his heart function. After seeing these films, the case started to ring a bell, and Dr. Barnard was right. This was a bad case. In fact, by now, it was even worse. While in the corridor on the way to look at the film studies, Dr. Barnard recalled his conversations he had with the doctors in America, Dr. Richard Lauer and Dr. Norman Shumway, regarding the criteria or circumstances in which one should do a heart transplant. And their criteria was essentially that the patient's condition must be so bad on that operating table that they can't survive unless they're on a heart-lung machine. Dr. Barnard truthfully realized it seemed very unrealistic because, for one, it would be hard finding an available donor while they needed them because a donor could only really be ready under tragic circumstances. And also, he thought it would be unfair to have Louis waiting for so long until said donor was available. So because of this, Dr. Barnard said that he would only do the transplant under 3 conditions. 1, Louis had to be in a condition that was irreversible and would eventually kill him. 2, all forms of treatment must have been attempted and proven of no avail. And 3, Louis must be close to the point of death. Based on his conditions and the film study of his heart, Louis fit all 3 of these criteria, with Dr. Barnard even stating that the studies, quote, showed advanced disease in a most dramatic manner. And it made him realize exactly why Louis was turned down for surgery in July before the idea of a transplant seemed possible, because the way these studies were looking, no surgery was going to fix that. Dr. Barnard was shocked Louis was even still alive at that point with a heart like that. After further discussion with Dr. Schreier and Dr. Schreier's assistant, Dr. Barnard called Dr. Kaplan, and Dr. Kaplan told him that Louis was accepting of the operation, and he suggested that Dr. Barnard should speak to Louis about it. And so after thanking Dr. Kaplan, Dr. Barnard headed to the A1 ward to find Louis. When Dr. Barnard got to his room, Louis was upright in bed reading a book. And once inside, Dr. Barnard introduced himself and they went on to discuss the potential heart transplant. Dr. Barnard told Louis the general information, and after this, he was expecting that Louis would ask him some questions and find out some more. But Louis had no questions. He was very firm on doing this, and there was very little that could sway him. In the afternoon, Louis's wife Anne and Louis's sister Annie came to visit him, and he told them about the possible heart transplant. But as he was telling them this, his wife was like, do you mean a valve? But Louis was like, no, I mean an entire heart. Both of them genuinely thought at that point that Louis was just delirious. But for the next 2 days, as they and the other family members and friends of up to almost 30 visitors a time would visit, he was telling them the exact same thing. They figured, okay, maybe he's talking about a pacemaker. But it was finally on the 3rd day when Louis was moved upstairs from his room in the A1 ward to a private room in the C2 ward, which was the section of the hospital Dr. Barnard worked in, when they realized he legitimately meant he was getting a heart transplant. It was on that day, Anne, alongside a few other relatives, met Dr. Barnard. And for the first time, Anne was not only introduced to him, but she was told details about the potential heart transplant. After discussing it for a bit, Anne asked Dr. Barnard, like, hey, what would you say his chances of survival are? And Dr. Barnard told her that his chances of survival with the transplant were about 80%, but without it, that it was 0. Further telling her that he's not even concerned necessarily about survival from the procedure, but rather he's more concerned with Louis being able to even stay alive to make it to the procedure. He told her, look, there may be a 20% chance he doesn't make it, but guess what? Without this procedure, there's a 0% chance he's making it. The thing about this 80% survival chance Dr. Barnard mentioned, though, is that many years later, researchers, especially bioethicists, would criticize this number as being misleading. Researchers have stated that these numbers Dr. Barnard mentioned were more so a belief than an actual proven concrete answer. But this was the number the family was told. So after Dr. Barnard left, Anne questioned Louis, like, Louis, are you sure you want to do this? Do you know what you're getting into? And Louis again stated that he is in fact doing it. After Anne went home that night, she called her family doctor, Dr. Weinrich, who'd been her doctor since she was 10 years old. And after asking him for advice, he told her, even if he was given a 10% chance, Louis should still do the procedure. While still rightfully nervous, this at the very least gave Anne the assurance that she needed. In the new ward, Dr. Barnard and the team did everything possible to keep Louis alive before the transplant. They monitored him regularly, checked his kidney and liver function, they gave him medications to maximize cardiac output and to treat things like the diabetes, anemia, and even the cellulitis since he still had it in his leg. Not just this, but they also did physiotherapy to get his lungs in the best shape possible. They also took several preventive measures to make sure Louis' environment stayed as sterile as possible, including washing him daily with hexachlorophene and antibacterial soap, treating his mouth with a special agent and nose with an antibiotic ointment, doing regular swabs of the skin, nose, throat, and rectum to test for pathogens, and even doing an extensive cleaning plan for the room. For 3 weeks, Louis stayed in the ward as his condition progressively got worse. He was no longer able to stand on his left leg, which in addition to still being affected, now had 2 red streaks running up it, and he had a difficult time breathing. He would occasionally cough up blood, especially when excited. His hand would shake. He had trouble raising his arms up, and he lost a lot of body weight. Louis was in the hospital for longer than a usual patient was, and even still, he didn't complain and rather would always have the ultimatum that they either do the transplant or he get up and go home, even if he couldn't walk. Time was running out, and Dr. Barnard himself was just waiting for the day they would be able to do the transplant. Dr. Barnard made sure to stay close to the hospital at all times, just in case a donor became available that would make that happen. This meant having to skip certain events, even including skipping a trip 2 hours away to attend an exhibition to watch his daughter Deirdre, who was a very talented national champion water skier who he actually coached himself. He regularly showed up to her water skiing events, but he had to skip this one exhibition because he was worried a donor might show up if he were gone. And this rightfully was the right thing to do because it would actually be just that next week on a Wednesday afternoon when this potential donor would in fact show up. There was a young man who was rushed to the Groote Schuur Hospital from a town called Riversdale. He had been on the back of a truck when he had suddenly fell off and hit his head. When he arrived at the hospital, things were looking really bad. His blood pressure was low, he had a thready pulse, and he was breathing irregularly. The neurosurgeons quickly placed him on a ventilator, a machine to help him breathe. And while his heart circulation had improved, his brain function was gradually beginning to deteriorate. Soon enough, although this wasn't an official term as of yet, the neurosurgeons declared the patient as brain dead. While this was very tragic news, knowing that they wouldn't be able to reverse the damage caused to his brain, on the other hand, it led the team to declare the man as a potential donor. After being told this, the heart transplant team got to work and started getting Louis ready for the surgery by cleaning him and shaving his chest and groin. He and the patient's blood types were compatible, with them being both A positive. Their tissue types were compatible, and they told Louis that it was looking like the operation might actually be happening soon. All it was a matter of was seeing if the man's family would consent to it. Dr. Barnard quickly made a call over to the Riversdale police station to ask if they could get in contact with the man's family, and he waited for several hours before they were finally able to reach one of his relatives. As he waited to receive the call back, Dr. Barnard made sure to contact a couple people on the team. This included his own brother, Dr. Marius Barnard, who too was a cardiac surgeon on the team. Dr. Christiaan Barnard would describe Dr. Marius Barnard as his right-hand man. And fun fact, years later, Dr. Marius Barnard would go on to become the inventor of the world's first critical illness insurance policy on October 6, 1983. Going forward, I'll be referring to Dr. Marius Barnard as Dr. M. Barnard and Dr. Christiaan Barnard as Dr. Barnard. Another doctor was able to find the man's father and talk to him on the phone. And it was during this call, while in a state of shock, the father gave the family's consent to the procedure. Everything was set in place. The donor was ready, Louis was ready, and the team was ready as well. However, despite this being the best opportunity to do the transplant, and despite most people being on board, there was one person who had a problem with the procedure going forward. And this person was Dr. Schreier. Dr. Schreier had a few concerns. He was very worried that using this person as a donor wouldn't have been a good idea. And at first, it wasn't because this donor had some health problem that would have affected them being a donor, but rather he was concerned because this very donor was somebody who was colored. I do want to acknowledge the use of the word colored in this case. In many places, especially North America, the term colored is considered offensive. Most notably, in the States, there's a lot of history behind the term, especially with the Jim Crow laws where systemic racial segregation was enforced, creating divides in spaces for those who are white and those who are black, aka what they referred to then as colored. Now, on the other hand, in South Africa, there is a history behind this term, which we will be briefly discussing, but the main note is that as of today in South Africa, this term is one that is accepted and not considered a slur like it is in places like North America. Dr. Emmanuel Isaac Tawalda defined that in South Africa, quote, the racial designation colored describes individuals who are defined as having a mixed racial background. And from everything I've read and people I've asked, the term doesn't necessarily just mean mixed race, but rather there's a lot more cultural and ethnic context dating back many years ago. At the time of the case, the term colored was defined differently than it is today, and while it is a generally accepted and commonly used term in South Africa today, that doesn't mean it's a term that's liked by all South Africans identified as such, but the main takeaway I'd like to convey is it may be a slur here, but in South Africa, it's not. And so going forward in the video, as I refer to the people who were identified as colored, just keep that in mind. Dr. Schreier had concerns of how the hospital might be viewed if they were to use a donor who wasn't white. So he told them he doesn't think they should do it. From 1948 to early 1994, South Africa had in place a policy or system of institutionalized racial segregation between those who are white in the country and those who are not white. This policy was called apartheid, which means apartness, and it was created by the white-ruled Nationalist Party of South Africa. Under the Population Registration Act of 1950, South Africans were either classified as black, white, and for for those who were mixed or just not solely Black or white, colored. And based on where they fit in this classification, they were physically separated to only be around others who were in that classification. Also, eventually later on, a fourth classification, Asian, was also added. With the apartheid, those who weren't white were not allowed to vote. They had separate schools, public facilities, and even had to live in separate areas. Even in the hospital, many of those were segregated as well, including the hospital in this case. Groote Schuur had been a segregated hospital since it opened up in 1938. They legally had to have a white side and a non-white side for patients. Dr. Barnard, Dr. M. Barnard, and many other staff members had firm stances against the apartheid. And while they did make many changes throughout the years, including hiring Black nurses to work in the white wards, having Black and colored people working and leading in the research lab during the time of this case, and eventually fully desegregating in 1987, this still was something that was happening at the hospital and many other hospitals during the time of this case. Even later on after this case, Marina Joubert from The Conversation stated that Dr. Barnard, quote, refused to allow ongoing segregation of Black and white patients in his intensive care wards at Groote Schuur Hospital. This held true as there were several colored and Black staff who actually worked in the hospital and played a major role in making this transplant possible. Most notably, because of these laws, there was a man kept in the shadows for several years following this case. His name was Hamilton Naki, and we'll discuss him and all the controversy regarding his role later in this video. It was also stated by Kahn and Lacken in the American Journal of Public Health, quote, apartheid laws and policies affected all aspects of the citizen's life, including the health sector. The South African healthcare system not only limited access to healthcare for Blacks and often ignored quality of care guidelines, but also created an environment in which abuses such as the refusal of emergency care treatment, falsification of medical records, denial or limitation of Blacks' access to ongoing medical care, and mistreatment of the mentally ill could occur. Black patients had a hard time getting access to proper healthcare, while simultaneously Black aspiring doctors and healthcare professionals were having a hard time even getting into schools that would provide them the education to become one. And even when they did get into these schools, they were still separated in different classes, and many of them had various restrictions placed on them. According to Ann Digby from the Medical History Journal, even the ones who were finished schooling and were actually doctors at the time, they would often be called things like troublemakers. They would be barred from getting hired at hospitals. And even the ones who did work at hospitals, they would still be segregated in the hospital and would often be pressured into handing their patients over to their white colleagues or to smaller hospitals in suburban areas. Before Louis was even introduced to him, Dr. Barnard had previously spoken with Dr. Schreier, stating that he actually thinks it would be a good idea to have the first recipient be someone who is Black. As he reasoned in his book, quote, take a Bantu with cardiomyopathy because it is a disease common to them with no known cure. This will give us a young man with a good body who has only one defect, heart disease. By the way, while the word Bantu can refer to a group of over 500 languages spoken in different parts of Africa, and Bantu peoples are considered those who speak said languages, during the apartheid, Bantu was a term that was used to classify Black people under the Act of 1950. However, this is a term that is offensive and should not be used in this way today. Donald McRae in the book Every Second Counts described the situation, stating, quote, Dr. Schreier insisted that they should restrict their search for a donor to the white population, which comprised less than 20% of South Africans. 90% of patients suffering from heart disease, meanwhile, were white, for they mostly lived with the indulgence of the typical citizen of the Western world. So while the overwhelming number of recipients in need of a new heart would always be white, the largest donor pool remained unsuitably Black. Growing up, Dr. Barnard's father was actually a missionary to people who were colored. But with this profession, they were often avoided by people in their community who were white, with Dr. Barnard even describing how some would go as far as to not shake his hand because they knew he shook the hands of over 30 people who were colored daily and were worried that it might rub off on them. In this situation with the transplant, Dr. Barnard cited how Black people commonly dealt with cardiomyopathy or diseases of the heart muscle. So he reasoned it would be a good idea if they were to work with someone who was Black to be able to give them a healthy heart. But Dr. Schreier did not like this idea because he believed that it would look bad for the hospital if they were to use someone who wasn't white as a donor, considering the apartheid laws, reasoning that if they were to use a Black patient as the recipient of the first ever human heart transplant, this might bring accusations of them experimenting on Black people who were already a marginalized group. I mean, this was something that had happened and was happening during the time of this case. Take the Tuskegee syphilis study in the United States, for example. Donald McRae described the concerns Dr. Schreier had, saying, quote, "In a country where Black life was rendered so cheap, Dr. Schreier was adamant that they could not risk following that same narrow path in an operation as pretentious as the world's first heart transplant." He reminded Dr. Barnard that hundreds of Black South Africans were hanged every year. Tens of thousands were jailed, while the remaining millions were oppressed and treated as little more than a cut-rate labor pool. The presence of a Black heart donor in a momentous transplant would refocus attention on apartheid rather than their medical breakthrough. So when they had a non-white donor ready to go, Dr. Schreier said no and told Dr. Barnard that the first recipient and the first donor must be white. And even though Dr. Barnard tried convincing him that this is what they needed to do to save Louis's life, in the end, it finally got to a point where they kind of were left with no choice, because after some time, they again evaluated the man's condition and they saw that his health had actually deteriorated so much that even now his heart was also damaged. The Barnard brothers knew that, damaged or not, this was a disagreement that was going to be a long back and forth anyway, and they knew it would be best at that point to not proceed. They now had to call off the procedure, and Dr. Barnard, who was very sad about this, went to Louis's room to break the news to him. When Dr. Barnard was telling Louis this, he saw how upset Dr. Barnard was, and so Louis tried to comfort him. He told him that when the time comes, it will come, and he reassured Dr. Barnard that he trusted him and the process. For those next few days, Dr. Barnard would constantly think about Louis and this transplant. He would go to sleep thinking about the transplant, he would wake up thinking about it, and eventually it finally did come time when the next donor was in fact available. On the afternoon of Saturday, December 2nd, 1967, Dr. Barnard woke up and he just came up with this idea to change the way they normally performed the procedure in the animal labs to hopefully prevent further damage whenever the human heart transplant operation occurred. He was intrigued by this idea, but he obviously hadn't practiced it before, so he called the C2 ward to see if he could discuss it some more. During this call, he got an update that Louis was feeling nauseous and his leg worsened. And it wasn't too long after they hung up when he received another call by a physician named Dr. Court Venter. And during this call, Dr. Venter told him that there was another potential donor. He told Dr. Barnard that this patient was a young woman. And after confirming that this patient wasn't Black nor colored, and after waiting for an hour for the neurosurgeon's evaluation, it was confirmed that they did in fact have a donor. This woman was named Denise Darvall, and she was 25 years old. Denise Darvall was born on February 27, 1942 to parents Edward George and Myrtle Ann in South Africa. Around 3:35 p.m. on December 2, 1967, Denise, her parents, and her 14-year-old brother Keith had been driving on the road to visit friends. Denise had just gotten a new car, a green Ford Anglia, so she drove with her brother in the passenger seat and parents in the back. They stopped by the Wrenchtown Bakery in Salt River to get a caramel cake for their friends. Denise and her mother got out the car to get the cake as her brother and father stayed inside the car waiting for them. But it was just as the women left the bakery to return to the car at about 3:40 p.m. when Edward and Keith heard a loud thud and screeching, and they quickly realized that Denise and her mother were struck by a car when trying to cross the road. The driver of the car, 36-year-old Frederick Prinz, a salesman and reserve police officer, was not able to see the two due to a truck blocking his vision. Likewise, it was this same truck that made it impossible for Denise and Myrtle to see Frederick as well. The thing about this, however, was that not only was Frederick speeding, but many sources state that he was also intoxicated. Anne, Louis's wife, and her sister-in-law actually saw the commotion as they drove home following visiting Louis. When the ambulance arrived, they took just 4 minutes to get the women loaded onto the stretcher, and they took 3 minutes to take them to the Groote Schuur emergency room. But it was unfortunately when they arrived, when Edward would receive the news, that Myrtle had unfortunately passed away from impact at the scene. And Denise, on the other hand, survived, but sustained life-threatening head injuries. They rushed her inside to see what they could do to save her, but unfortunately, in the end, the damage to her brain was too severe. Around 9 p.m., she was declared brain dead, and shortly after, her father and brother were told by Dr. Venter that there was nothing else they could do. When Dr. Barnard talked to Dr. Venter on the phone, they didn't yet have the consent to perform the transplant, so he quickly rushed to the hospital to try to figure out the situation. Dr. Venter talked to Denise's father privately and told him, "Look, there's nothing we can do to bring back Denise. However, there is a man in here who's needing a heart and someone else who needs a kidney. If you could give us your permission, can we use your daughter's heart and kidney to save the lives of somebody else?" This other person Dr. Venter was referring to was a 10-year-old boy named Jonathan Van Wyck. Jonathan was a boy who was colored, and because of the apartheid, this transplant was one that would have likely been considered controversial at the time. At the time, Edward didn't know that the kidney was going to be going to a boy who was colored, but he later on said this didn't even matter to him. Edward thought about the donation for a total of 4 minutes when in the end he told Dr. Venter, quote, "Well, doctor, if you can't save my daughter, try and save this man." He thought Denise would have wanted for him to help save another person's life. So Dr. Venter brought Edward a form and a red card. He signed it, and they now had consent to proceed. Denise's kidneys were taken across town to the Carl Bremer Hospital. Ultimately, Denise's heart was the perfect candidate to be transplanted into Louis, because not only was her blood type O negative, so this made her a universal donor, but their tissue type was also compatible as well. Due to a lack of clear guidelines on brain death at the time, there was a lot of debate around whether Denise could be considered alive or not. The concept of brain death was first introduced in 1959 by Molleret and Coulon, who referred to the idea as coma dépassé, which translates to a state beyond coma. However, the actual first criteria for what counts as brain death would not be published until the following year after Louis' case in 1968 by Harvard. The first place to legally accept the definition of brain death was Kansas in 1970, and the first country to legally accept the definition was Finland in 1971. So the practice at the time before that was typically that death was called at the mark of whole body death, as in when the whole body is dead, including the heart. In Denise's case, however, her heart was still healthy despite her brain being dead. Even though Dr. Peter Rose Innes confirmed Denise as medically dead, Dr. Barnard stated that she still technically wasn't legally dead. By legally, he likely wasn't referring to the laws of South Africa, because in South Africa, there weren't strict laws regarding this. But rather, he could have been referring to laws in the States where the other members of the heart transplant race were located. Donald McRae has stated, quote, "Contrary to U.S. law, South Africa was unique in basing the definition of death only on the agreement of two physicians rather than the cessation of any vital organ. So with this, Dr. Barnard and his team were legally allowed to proceed with this operation. Dr. Barnard described that Denise was being kept alive by, quote, drug stimulants, drug transfusions, and artificial breathing provided by the automatic ventilator. If they were to stop the ventilator, her heart would likely beat for just a few minutes before stopping. So the moral dilemma was that, is it ethical to keep her alive with no brain function and reliant on a ventilator, or is it ethical to just take her off? Eventually, after a lot of thought, they ended up referring to the fact that most surgeons at the time agreed with Pope Pius XII, who in 1957 told a group of physicians that they are not morally required to conduct artificial and extraordinary means of resuscitation. So based on this and several other reasons, they ended up just following this. They were going to take Denise off the ventilator, and to ensure vitality of the organs, they were going to do this at the very last moment once they were ready to go. They prepared to bring both Louis and Denise to different operating theaters. Louis was in Theater A and Denise was in Theater B. But these weren't just any operating theaters. These were operating theaters which were adjacent or adjoined to one another. Theaters A and B were separated by two connecting rooms. One room was the setting up room where they sterilized the instruments and set out trays. The other was the scrub room closer to the corridor where the team would do their final wash and scrubbing before putting on their surgery attire. With these adjoined theaters, while they prepped Denise in Theater B, it would be in Theater A where they prepped Louis. One of the main concerns regarding the transplant was that Louis's body would identify the heart as a foreign body and begin to attack it, aka reject the heart. Because of this, Dr. Barnard preemptively prescribed Louis several medications with immunosuppressant properties to weaken his immune system, making it harder for the body to go after the new heart. He was given anti-inflammatory steroids before the operation in anticipation of heart rejection. Specifically, he was given hydrocortisone and he was given prednisone. Both of these are corticosteroids, and amongst other functions, they are used to suppress the immune system so that in this case, the immune system wouldn't attack the heart as foreign material. Dr. Joseph Ozinski, the anesthesiologist, brought Louis to Theater A, and it was while Louis was on his way to the operating theater when the reality truly started to kick in for Dr. Barnard, that there were no more hurdles. This was now happening. Dr. Barnard met in a room with the team consisting of Drs. M. Barnard, Bossman, O'Donovan, and Francois Hitchcock. And he again just made sure everyone was ready for their role and understood how time-sensitive everything was. Louis laid upright on the table, ready for the transplant, stating, quote, "So it's out with the old and in with the new, auld lang syne." And shortly after this, at around 1 a.m., early that Saturday morning, a team of about 30 staff led by Dr. Barnard got started with the procedures. Dr. Barnard walked into Theater B where Denise was in to see how they were doing. But as Dr. Barnard looked over at the EKG, he saw something that he didn't like. And Dr. Venter, who was in charge of the IV drips, also felt the same way as well. Dr. Venter was like, "Look, her heart is deteriorating." Dr. Barnard had an idea. He thought it would be smart to open up Denise's chest right then and there and then use the heart-lung machine paired with cooling to hopefully preserve the heart for longer as they got Louis ready. But this is where that ethical dilemma came up again, because Dr. Barnard had a hard time thinking about the moral implications of cutting a patient who wasn't yet conventionally dead. He described, quote, "It was a question of timing. Two people, both with dying hearts, had to be held in position until we were ready to remove one, then replace the other." Dr. Barnard headed back to Theater A, and after his chief assistant, Dr. Hewitson, arrived, they were ready to begin what they described as the cut down of Louis. Dr. Hewitson was assisted by Dr. Hitchcock in this cut down, and as they began doing that, Dr. Barnard again left to Theater B to see how everything was going. But unfortunately, when he walked in, he saw that Denise Denise's condition was continuing to get worse, because not only would Dr. Venter provide readings that weren't looking good, but Dr. O'Donovan would explain that now she had internal bleeding. At that point, Dr. M. Barnard simply just wanted to pull the switch and place her on bypass, as the neurosurgeons themselves stated they can in fact pull at any time. And Dr. O'Donovan agreed with pulling it, not only because of what the neurosurgeon said, but rather because he reasoned that even with stopping her ventilation at the last minute, it might take anywhere from a few minutes to even 20 minutes before the heart fully stopped beating. Louis was getting his chest cut over in the next room, so if they didn't have the heart ready by the time they were finished cutting, they might have had to wait up to 20 minutes with his heart exposed in the open, which would not have been good. The other issue was, what if they got Denise ready to go, her heart was exposed, but then there was an unexpected delay that caused Louis to not be ready? But in the end, Dr. Barnard told them, you know what, we're just going to have to wait till Louis was open and ready for bypass. And he further said that only then would Denise be put on bypass and he will remove her heart. And he just reiterated once again that once Louis is ready, they're just going to have to move really fast. Dr. Barnard went back to Theater A to see how they were going. And finally, they were able to get Louis' chest opened up. They were now able to fully see Louis' heart in person, and they were absolutely stunned at how damaged it was. Dr. Barnard quickly hurried into Theater B and he told them it was time. They turned off the ventilator, and after 50 minutes, her heart flatlined. They waited just 3 minutes to make sure that her heartbeat didn't come back. And after this didn't happen, it was finally time for Dr. Barnard to head into the scrub room and get scrubbed. This process took 5 minutes, and in those 5 minutes, he made sure to yell out to both theaters to remind the team members of what to do. Once he was done scrubbing, a nurse poured antiseptic solution over his hands. He got his attire on and he headed to Theater A, and he gave them the okay to, quote, start the pump of the heart-lung machine, putting Louis on bypass. They got on with the procedure ready as they had practiced, and behind them was an open amphitheater with several doctors and specialists, also in masks, watching. For the heart-lung machine, they inserted a line through Louis' groin to attach to an artery around his heart. But his artery was very narrowed, and because of this, fresh blood was being blocked from coming out of it. The concern with this was that if there wasn't enough blood being provided to Louis' body, then they wouldn't be able to keep him alive while doing this surgery. And because of this, they ended up removing the arterial line from being attached to an artery outside of the heart to instead attach it directly to the heart through the aorta, which is the body's largest artery originating at the left ventricle. This is where the problem came though. Whenever you clamp a line attached to a pump like a heart-lung machine, you need to turn the machine off. Otherwise, the pump would push against the closed clamp. The thing with this case though is that when they clamped the line to make the adjustments, nobody ended up turning off the heart-lung machine. So as soon as that line was clamped, the line literally blew at the weakest point, which was the heat exchanger. And because of this, blood started spilling on the floor. And it wasn't just this, because this then caused air to fill up in the heart-lung machine. And to fix this, they had to take the ends of the two lines out of Louis, connect them, and then restart the machine for 2 minutes to get it to debubble. Once Louis' heart collapsed, Dr. Barnard headed to Theater B to remove the donor heart before heading back to Theater A at 3:01 a.m. to perform the transplant. And I'll just tell you, this transplant was going to be a very extensive process. What he essentially had to do was he needed to cut around each individual vessel, making sure they stayed intact, so that he would be able to remove Louis' heart without cutting anything important. If you remember, as we discussed earlier, this would be an orthotopic heart transplant. To put it in perspective of how this process was, Dr. Barnard described it saying, quote, after the 2 great vessels, there remained 6 lesser ones, entering the upper chambers of the heart. These had to be left in place. I would cut below them around the top of the heart, leaving the lid with all its veins in place. It would be like carving a jack-o'-lantern from a pumpkin. The stump to be left behind would be the lid of the pumpkin. So once everything was carefully cut, Dr. Barnard removed Louis's heart from his chest, and it was after this when he trimmed around the donor heart to make sure everything would fit just fine. Remember how earlier in the day when he woke up, Dr. Barnard came up with an idea of a new way to perform this operation? Well, he explained that this idea was to make the cuts in a specific way that would actually avoid cutting the septum of the donor heart. Just before he started working on the donor heart, he told Dr. Hewitson, "Guess what? I only came up with this idea today while in bed." And Dr. Barnard later described he didn't realize this would likely be startling to Dr. Hewitson. Nonetheless, he got on with doing it, and once done, Dr. Hewitson gently lifted the donor heart into Louis's empty chest, and they subsequently began sewing the aortas together. The doctors described that when inside Louis's chest, the heart looked so small because not only was a female's heart about 20% smaller than a male's, but Louis's heart was already so big that it created a cavity twice the normal size for a male. As they stitched the aortas together, they began warming his blood, and finally at 5:34 a.m., the last suture was finally tied. After this, the team removed the clamp on the aorta, and soon enough, warm blood began filling into the heart and it subsequently began to contract. This indicated the first sign of life in the heart since it stopped beating in Denise's body almost 3 hours prior. They were now ready to defibrillate Louis's heart to try to restore a normal heartbeat. Slowly but surely, with the defibrillator machine, the heart started to beat and the rhythm continued getting stronger. And this looked great. When turning the heart-lung machine off during his experiments on dogs, it was common for Dr. Barnard to need to do a few tries before the heart was able to beat on its own. So once they turned it off for Louis, it took them 3 whole tries of turning off the machine, the heart collapsing, and then needing to turn it back on before the heart was finally able to sustain its heartbeat on its own. Finally, they were now officially done with the transplant procedure, and after about 2.5 years of struggling with the illness and 5 hours of the procedure, they now had successfully transplanted Denise's heart into Louis's body. The team went on to give Louis the necessary medications to help give his body the ability to form blood clots to seal the wound before sewing up his chest and beginning him on anti-rejection therapy. And at around 6:05 a.m., the doctors called Louis's wife, Anne, to inform her the surgery was a success. The team usually took a picture of the chest in the theater following surgeries, but it was early Sunday morning and they couldn't find any technicians around, so they just got ready to wheel him to his room in the C2 ward. This was up 1 floor and 20 yards down a corridor, and it was a short trip, but with such an extensive procedure done on his body, it still was concerning, so they just made sure to be careful when taking him there. When they placed him onto the bed, he actually lifted one arm up and moved his head. He couldn't talk just yet because he still had endotracheal tubes down his throat, but eventually he was able to open his eyes, and he even nodded his head dully when they spoke to him before falling asleep again. The post-operative care of Louis would go on to be strictly regimented and carefully tracked by his medical staff. The main goals for the post-operative care of Louis was to ensure his body accepted the new heart while also maintaining cardiac output and preventing infection. They continued on with the sterile practices they were doing pre-op, but additionally, they made it a requirement for people to scrub in a dedicated area and put on a sterile cap, mask, gown, gloves, and canvas overshoes before entering Louis's room. They changed the bed sheets and mopped the floors twice daily. They monitored his wounds to ensure no risk of sepsis, and they took blood cultures daily. To prevent his body from rejecting the heart, they continued Louis on high doses of immunosuppressive medications. While putting him on high-dose immunosuppressive medications was done with the intent to prevent his body from rejecting the heart, on the other hand, in doing this, it raised the concerns of weakening Louis's immune response so much to the point where he'd be very susceptible to serious infections and unable to fight off dangerous pathogens. This had never been done before, so So the team figured the best bet would be to keep the immunosuppression strong and hopefully avoid infection as best as possible. As Dr. Barnard left Louis' room to get Dr. Schreier to take a look at Louis' heart function, in the corridor, he ran into Anne with her brother-in-law, Tevye, and family friends, Solly and Lily Cameraman, and he told them that their surgery was a success. It's just a matter of keeping him safe from infection and other concerns. And when Dr. Schreier took a look at Louis, he too saw that everything was under control. And even over at the Carl Bremer Hospital, the kidney transplant was successful as well. It didn't take too long before the media got a hold of this story, and people from all around the world were absolutely stunned. On his way home from the hospital, Dr. Barnard heard the 12 o'clock news on the radio where they announced that, quote, "The first human-to-human heart transplant in history was done last night by a team of doctors at the Groote Schuur Hospital. The name of the patient as well as the donor are being withheld by hospital authorities." Even though the media coverage briefly started off fine, eventually all the concerns Dr. Schreier had regarding controversy related to apartheid actually came true. Eventually, through a news bulletin, people were able to figure out who the recipient, donor, and doctors were. And Dr. Barnard would go on to receive so many calls asking not only about the procedure, but also about the race and religious status of the patients. He was irritated because to him, the color of the recipient's and donor's skin shouldn't have mattered. All that mattered to him was the fact that a life was saved. And this wasn't just from South African media companies, but he also received a call from a German magazine in Berlin. He received a call from a TV network in New York, and he just received calls from everywhere from different types of companies. Dr. Barnard spent that entire night anxious because he was always thinking about how Louis was doing. But all the while, he's attached to his phone waiting for a call in case he needs to come back to the hospital for an emergency. He was receiving several calls to speak to news publications from around the world. This media attention continued for days, even weeks, and soon enough, Louis himself would be plagued with many interviews. Every day for the next few days following the transplant, the doctors from each specialty would meet to discuss what they could add to help his recovery. On Tuesday, December 5th, the second day post-op, Louis, who was now wide awake, was in a good mood. When they had taken the endotracheal tube out of his throat, according to the Heart Matters magazine, his first words post-surgery were, quote, "I'm still alive." Despite them having to turn him from side to side throughout the night to help him with his breathing, and despite them doing blood work regularly, Louis was in good spirits, even jokingly referring to Dr. Bossman as Dracula because of the constant blood work. The next day, third day post-op, Dr. Barnard accepted an invitation to the States to be on a nationwide news panel to discuss the surgery on a show called Face the Nation. On this day, Louis' spirits were still high. For anti-rejection methods, they also began radiation, targeting the heart directly with an increasing dose that would actually continue until day 9. And things looked to be going in the right direction as he looked pretty stable and his pumping capacity had improved. But it was just that next day, the fourth day post-op, when Louis' heart rate would rise from 130 beats per minute to 160 beats per minute with persistent atrial flutter. Because of this, the team decided to give Louis digoxin to slow it down. And shortly after midnight, the digoxin successfully dropped Louis' heart rate to 110 beats per minute. But even after being given a dose at 1 a.m. and 2 a.m., when he woke up the fifth day post-op on the morning of Friday, December 8th, his heart rate was back up to 150 beats per minute. And not only this, but Louis was no longer in high spirits because now he was irritable and sluggish. They reasoned this could have been stress, but they also reasoned it could have been a sign of rejection. Based on how long the heart had been in, it was expected by Professor Jamie Lau, the chief of the hospital's Department of Surgery, that Louis' body would begin rejecting the heart by now. But this wasn't all they were worried about today, because one of the biggest concerns on this day was when Dr. Forder, the bacteriologist, reported that after testing a rectal and mouth swab that they'd done 2 days prior, they found Klebsiella, a dangerous organism in Louis' left nostril. Because there was now this pathogen, and also because they suspected that the rejection had started, they decided to increase Louis' dose of prednisone, the steroid, while also making changes to the types of antibiotics they used. The thing is, steroids, especially when used in such high doses, can come with very concerning side effects, and the doctors were worried about the dangers associated with increasing the steroid dose. Most notably, they were concerned that such a high dose could cause acute stomach ulcers with bleeding, while also aggravating the diabetes. But at that point, the reward outweighed the risk, so they continued on with it. On that day, Louis had his first bedside radio interview in which he described Dr. Barnard as, quote, the man with golden hands. Even when people called him famous during these interviews, Louis would always credit the doctors instead as being the famous ones, not him. Because Dr. Barnard didn't want anyone in Louis' room to protect him from infections, he made sure that in any interviews conducted, the camera crew stayed outside, and if a mic needed to be involved, a doctor, such as Dr. Bossman in this case, would be inside holding it. And after they started making the changes in his treatment, Louis' condition improved tremendously. For those next 5 days, from Saturday the 9th to Wednesday the 13th, days 6 to 10 post-surgery, Louis was finally able to truly live a new life with a properly working heart, and he was really enjoying himself. On Wednesday, he woke up again with humor. His heart rate was between 88 to 100 beats per minute. The cellulitis in his leg was gone, and he was even moved from the recovery room to a different room that was set up differently so that whenever he got photographed, they wouldn't have to go inside. While everything was looking fine and Louis seemed stable, it unfortunately again didn't take too long before he began experiencing some new issues. On day 9, Louis had abdominal pain, which was manageable, and it improved pretty quickly. But on the night of Wednesday, December 13th to 14th, so day 10 to 11, 3 times that night, Louis woke up with severe pain in his abdomen. And each time he woke up, this pain was only relieved when he got something to eat. This also happened in the morning when he woke up. Prednisone is a medication that can cause increased appetite and can cause serious food cravings. It's one that can cause insomnia, and it's one that can increase acid production in one's stomach. Everything he was dealing with that night showed all 3 of these side effects, and he was irritable, which again is another side effect of steroids like prednisone. And even though they were trying to balance the acid in his stomach by giving him alkaline, this new intensified pain had the doctors worried an ulcer was forming. Not just this, but over those past 4 days, Louis' white blood cell counts went up from 15,900 to 19,860. While this could have indicated an infection, the doctors concluded it was likely due to the high-dose steroids, and they reasoned that this would probably get better as they were just beginning to reduce his dose. While he slept fine that night, he again woke up 3 times with stomach pains and again was relieved when he drank milk and ate toast paired with antacid pills. After a restless night, Friday, December 15th, the 12th day post-op, Louis woke up with pain in his left shoulder, which an x-ray confirmed to not be very serious, and he was still feeling sluggish and irritable. This could have indicated that something was wrong, but also could have again been stress, especially considering that day he was photographed by the Stern, interviewed by the BBC, met with the minister, and was televised by CBS. Stress could have been a factor because while most of these meetings were fine, as this had happened before, for some reason, the BBC began asking odd questions about his and the donor's religion, and Dr. Bossman cut the interview short and confronted them after this. Louis was excited that day as he was finally able to see his wife for the first time in 5 days, as she'd been sick with a cold and sore throat. Anne herself had even done an interview with the press the prior week when she visited before coming down with the cold, but everything else looked good. The stomach pains were under control, and even the white blood cell counts had dropped. Dr. Barnard described Louis' heart as looking, quote, better than ever. But after those 5 days of everything looking great, it was, however, on this very day, on the 15th, when the doctors were hit with information that was extremely concerning. Because in the latest x-ray image of Louis' chest, there was a, quote, minuscule shadow in the left lobe of the lung. The next day, the 16th, which was the 13th day post-op, Louis told the team he was not good. His voice was hoarse, his eyes had dark rings under them, he was breathing more rapidly, and even his lab results showed this. His respiration rate went from 20 to 24. His pulse was up to 100 beats per minute, his blood pressure went down, and his temperature was a very high 101.6 degrees. Then, after looking at his latest x-ray, Dr. Barnard actually confirmed what he described as his worst fears, because he saw that small shadow in Louis' left lung had now grown. In fact, it was 100 times bigger and had spread from the left lung to the right lung. Louis' lungs were being rapidly invaded by a pathogen, and they needed to figure out what it was so they could immediately treat it. Dr. Barnard thought that this infection might be pneumonia, but even if this were the case, they needed to wait for the results to confirm if this was viral, fungal, or bacterial, as these each would require different treatments. So as they waited for results, shortly after 1 p.m., they decided to just treat Louis for pulmonary infarction, which refers to, quote, the death of lung tissue due to a lack of blood supply. It was finally in the evening when they received the sputum findings, which are the results from the cultures, when they officially were able to diagnose Louis with pneumococcal infection, a bacterial infection in the lungs, and they subsequently started treatment for it with penicillin. The following day, the 17th or 14th day post-op, Louis was getting worse by the hour. He was suffering both urinary and fecal incontinence. He had diarrhea. Breathing was harder. He refused to eat, drink, or just cooperate in general, and he was having a hard time staying hopeful. Although the morning x-rays showed that his lungs were clearing and the sputum findings showed that there were no more traces of pneumococcal bacteria, there still was more growth of something in his lungs, which doctors figured might have been a different type of pathogen. They just didn't know what this pathogen was, and making matters worse, his white blood cell count began slowly dropping. Not just this, but in addition to an insignificant growth of the Klebsiella, it was then for the first time they also found a small amount of Pseudomonas bacteria in the sputum findings. There was only a little amount of the bacteria, so Dr. Forder reasoned that they were likely only located in the oral cavity, but they would soon find out that this was not the case. The next day, on December 18th, the 15th day post-op, with Louis' worsening condition, Dr. Barnard ended up canceling a non-emergent operation he had scheduled for someone else, and he even talked to Eddie Steinhardt of CBS to cancel the interview he scheduled for later on with Face the Nation in Washington, which definitely needed to happen because just the next morning of the 19th, on the 16th day post-op, Louis woke up in a mentally confused state and he was speaking incoherently. They found out this was due to hypoglycemia, aka too little blood sugar, and so they gave him glucose. But what was more concerning was that at 6 a.m., they found that his white blood cell count had dropped from 22,200 to 5,640. This was very drastic and very dangerous, especially as he had an active infection. At that point, they decided to stop giving Louis the anti-rejection drugs actinomycin C and Imurin, as these could have been contributing to destroying his white blood cell count, and they instead raised the other anti-rejection drug, prednisone, from 200 milligrams to 400 milligrams, while also changing the doses of other medications. While the amount truly depends on various factors, including what you're even taking the steroids for, according to drugs.com, the usual initial dose of prednisone for an adult typically is between 5 milligrams to 60 milligrams. Of course, higher doses may be prescribed depending on the case. Nonetheless, you can see that Louis was well over that amount. After giving Louis a leukocyte or white blood cell transfusion twice, his white blood cell count actually temporarily rose afterwards, but only shortly after they continued falling. And with the infection, Louis's lungs were getting so bad, it got to the point where he was actually starting to turn blue from the lack of oxygen he was receiving. It was after this, and after convincing him that this was what they needed to do, they decided to put Louis back on artificial respiration with the endotracheal tube. And finally, after waiting for the results from his lung infection, it was the next day, on Wednesday, December 20th, the 17th day post-op, just after 1 p.m., when the bacterial report from the sputum samples the day before finally showed them the answer. Reading, quote, "From the sputum specimen of December 19th, heavy growths of Klebsiella and Pseudomonas have been obtained. This indicates the patient is suffering from extensive bilateral pneumonia due to these organisms." This report stated that Klebsiella, which were initially in his mouth, were now in his lungs. And the Pseudomonas, which it didn't seem like there was much of, were now in his lungs as well. This was strange because from the findings a few days ago, it seemed as if the Klebsiella was stable and wasn't causing too much issues. Well, what had happened was the Klebsiella, which were originally in his mouth, left the oral cavity, making it appear as though they weren't populating in the mouth, only for them to have been crawling their way down into the lungs. You see, they weren't the first ones there in the lungs. The pneumococcal bacteria were there first, and they gave Louis penicillin to treat the infection in his lungs. But Dr. Forder explained what probably happened was that using the penicillin did in fact get rid of the pneumococcal bacteria, as it should have. But in doing this, it exposed space for an immunocompromised Louis for the organisms to make their way down to the lungs. They gave Louis a bunch of antibiotics, and when he woke up, Dr. Barnard told him that they finally had the answer they needed to properly treat him. Louis tried to speak, but couldn't do so with the endotracheal tube. And after seeing what was going on, an emotional Anne and Louis's loved ones all came down to pay him a visit. Louis was able to reply with nods as the doctor spoke to him, and by 1 a.m. it actually seemed to Dr. Barnard that Louis might actually make it, as he was looking more stable and some of his counts, like his hemoglobin, were looking a bit better. But this was only short-lived because shortly later, Louis's PO2 level, or the amount of oxygen dissolved in his blood, dropped from 60 to 50, then to 40. And Dr. Barnard described, quote, "His body became cyanosed or blue as the arterial blood lost its oxygen." He was not getting better. Rather, the bacterial organisms were continuing to spread in his lungs. Dr. Barnard did not want to give up. In fact, he proposed the idea of taking Louis off the ventilator and putting him back on the heart-lung machine so that they could buy more time to fight the infection. But it was after Dr. Schreier told him there was really no chance at that point and explained how that might just be subjecting Louis to more agony, when Dr. Barnard described, quote, "How much of this was now myself and how much was Washkansky? If there was a chance, then anything was worth trying, and it was all for Washkansky. If there was none, then it was all for myself. And the heart-lung machine was madness." Dr. Barnard realized that truthfully, there was no chance, and he told Dr. Venter it was time to let the family know. Dr. Barnard told Louis's family that they did everything they could. Everything was fine with the heart, but his lungs were not. It was after this, Anne, for the first time in weeks, touched her husband's face with no gloves on. Louis's eyes were kind of fixed and he wasn't able to talk, but Anne stayed by his side in what she knew would be the last moments of his life. Louis's family came in one by one to see him, and it was early that Thursday morning around 6:30 a.m. on December 21st, 1967, after 18 days of having the new heart, Louis Washkansky would pass away at the age of 55. Dr. Barnard then thanked each of the team members before going into a room alone and standing there in silence. The whole team was emotional and in shock at everything that just happened. Some even were crying before he passed and after. On that very day Louis passed, Anne gave the team permission to perform an autopsy, and they determined that Louis passed away from his lungs being filled very fully of blue-green pneumonia, causing respiratory failure. Ultimately, according to Dr. Barnard, the heart transplant itself was successful for Louis. He didn't pass away because of the heart heart transplant itself. The issue instead was that he was susceptible to infection due to his weakened immune system caused by the extensive immunosuppressive treatment plan he was on post-surgery. 9 days after he passed, on December 30th, 1967, Dr. Barnard released his publication on the case detailing the transplant as a success due to the fact that the heart did not need further machinery to continue beating for those 18 days. Due to this, in the paper, there were no mentions of Louis passing away. Even though this had just happened, it wasn't too long after this when Dr. Barnard was already ready to perform his next heart transplant, and the recipient of this was going to be a dentist named Dr. Phillip Blaiberg. Right after leaving Louis' autopsy, Dr. Barnard had been speaking with Dr. Blaiberg and his wife about this possible transplant. He told them about Louis passing away from pneumonia, and he told them after he's back from his 10-day trip to the States to be featured on Face the Nation, he was more than ever willing to do the transplant if that's what they wanted, considering what happened the first time. Dr. Blaiberg let him know that this is what he wanted, and after Dr. Barnard got back to South Africa, this transplant would successfully be performed on January 2nd, 1968. An interesting note about this procedure was that the donor, a 24-year-old man named Clive Haupt, was in fact someone who was colored. Clive Haupt had suffered a brain hemorrhage while out on a picnic with his wife Dorothy, whom he'd actually just married 3 months prior. His mother had given consent for the team to use his heart for the procedure. Thousands of people attended Clive's funeral, including Dr. Barnard, the team, and even Dr. Blaiberg's wife, Eileen. And something notably pointed out was that there were people of all races who were there, honoring this young man's life. This was celebrated as being progressive, but also sparked skepticism as Dr. Schreier had been concerned about. Dr. Blaiberg would go on to live for 19 months and 15 days before passing away on August 17, 1969. While this was progress regarding the time of survival, it did present a lot of issues that did need to be worked on for the future. In a news article from January 29, 1970, it was described that, quote, of the 594 days he lived with a new heart, Dr. Blaiberg spent 248 in the Cape Town's Groote Schuur Hospital fighting for his life, and of the days at home, he spent 95 in bed. He may have held a glass of beer for photographers, Mrs. Blaiberg said, but what kept him alive were the pills he took, 32 to 100 a day. With his daughter, Jill Blaiberg, stating, quote, I believe in anything and I emphasize anything that prolongs human life, and I also emphasize the word life. But as far as the transplant goes, the medical people and scientists concerned must do further research because being his daughter, I know that there are personality side effects, both emotional and physical. They must first perfect the operation before going on to do more operations. I do not wish to say any more. So as you can see, like Louis' post-op treatment, Dr. Blaiberg's post-op treatment too relied very heavily on strong medications. While they were able to keep him alive for almost 2 years, he spent a good chunk of it absolutely unwell simply because the only way they could have kept him alive at the time was to keep him on extremely powerful medications or at high doses, similar to how it was for Louis. So Jill and many others would argue, yeah, you saved their life physically, but what about the consideration for the quality of life following the procedure? And this wasn't just something stated by Jill, but Louis' case in general actually sparked a lot of criticism from many people. Dr. Barnard received many critical letters of people voicing their concerns. Dean Friedman, who was a specialist nurse present during the operation, later described, quote, we did not realize that it would take the public by storm and create such an outcry. There were people who wrote quite critical letters to Professor Barnard, horrible letters calling him the butcher. Further reading one letter that was sent from Illinois just a month after Louis' procedure, which stated, quote, I have heard of human vultures, but it is the first time I have saw one with a name on it. And another from Hong Kong, which stated, quote, you had the audacity to assume the authority of God by pretending to become the giver of life. There were also many people who argued that Dr. Barnard rushed to do this, knowing that there were people more qualified, i.e. Drs. Shumway and Lower. And according to Donald McRae with The Guardian, Dr. Barnard was even supposedly shunned by doctors at a conference in the US after he hadn't acknowledged the American pioneers during his speech. And it states that following this, the only person to shake his hand was Dr. Richard Lower, who, by the way, many years later in the 2008 article described the situation stating, quote, "It was a shock when we got the news about Barnard. His old technician told my lab guy he was going back to South Africa to do it first. I never believed him. We believed you had to do years of research before you tried this in a human. He was different." On the other hand, what he had done was something that hadn't yet been done before, and many in the scientific community would celebrate him for making such a giant step for future heart transplants. Not just this, but many people of the public also were fans of Dr. Barnard as well, and he would soon go on to amass a lot of fame. With his charisma and charm many described he had, he gained a lot of attention.
And please, would you explain histologically for the benefit of a lot of us?
We have some slides. If you can we project them somewhere?
Yes, we can indeed.
I'll tell you, if we could have. Would you like just the heart?
Well, there's a letter
He would be featured in interviews, magazines, shown on TV, and he would meet all kinds of celebrities and prominent figures, including Muhammad Ali, Princess Diana, and even Nelson Mandela. He would also go on to write his biography titled One Life, co-written by Curtis Bill Pepper, which I got most of the information for the case from, and I'd recommend checking out. After this heart transplant happened, there was a boom of heart transplants all around the world. In fact, Dr. Norman Shumway notably described this, saying, quote, "Suddenly, heart transplants were being done in places where one would hesitate to have his atrial septal defect closed." Rounding out the 4-team race, Dr. Kantrowitz technically was the next to perform a heart transplant 3 days after Dr. Barnard on December 6, 1967, making this the second in the world. However, the patient only lived for a few hours afterwards. Then followed Dr. Shumway on January 6, 1968, which the patient lived for 15 days following. And rounding them out, Dr. Lower on May 25th, 1968. Okay, y'all, so normally I just do a voice recording whenever there's stuff I want to add. In this video, you might have noticed I've done that multiple times because I swear the longer I was editing, the more information I was finding. But anyway, what I found out just now just has me absolutely flabbergasted, so I had to get on camera and just talk to you directly. The transplant Dr. Lower did resulted in a wrongful death lawsuit, which is something I actually had written in my notes. The thing is, most sources that mention it just mention, the laws regarding brain death and all of that, just like the stuff we've been talking about. And it was just now when I finally clocked that the lawsuit he was involved in was regarding a man named Bruce Tucker. And the reason it was even filed was because this was a Black man who had suffered a severe head injury. And Dr. Lower, alongside Dr. David Hume, actually took this patient's heart and implanted it into the chest of a white businessman without the family's consent. Kind of just bringing back to what we were discussing previously with apartheid, how Dr. Schreier was concerned. This is literally kind of word for word exactly that. I remember hearing about this case a while ago, but I'm now just realizing that it was involving Dr. Lower, and it honestly just caught me off guard, and I think it definitely warrants a follow-up video. In 1968, out of the 104 procedures performed, only 10 survived. By the 1970s, they developed better methods for anti-rejection. But these still weren't that successful, and it was mentioned in a Life magazine cover story titled "The Tragic Record of Heart Transplants." By 1971, out of the 166 heart transplants performed, only 23 survived. Dr. Barnard always defended these procedures, acknowledging that they gave dying people a chance at new life. And in 1997, Dr. Barnard paid tribute to Dr. Vladimir Demikov. Dr. Barnard had actually flown to Moscow to meet Demikov in 1960, 7 years before this case. And he credited him, stating, quote, "I have always maintained that if there is a father of heart and lung transplantation, then Demikov certainly deserves this title." Dr. Barnard would retire in 1983 at the age of 61. Even after retirement, Dr. Barnard would go on to write several books on medical science. He would do public speaking, consulting, lectures. He operated his own farm, and he started the Christiaan Barnard Foundation to benefit underprivileged children worldwide. And he contributed to many of the changes made at the Groote Schuur Hospital, including them fully desegregating in 1987. Dr. Barnard did enjoy being in the limelight, but with the fame, of course, came controversy. In a 1993 memoir, he later addresses his personal scandals involving infidelity from before and after the transplant, his struggling first marriage, and his later marriages, which notably included one with a 19-year-old when he was 47 and a 24-year-old at 65. Well, not only was his personal life heavily discussed, but in later years, there would actually be some controversy regarding the actual heart transplant case. Because even though there were issues regarding using a Black or colored recipient or donor, some would allege that there was actually a Black employee on the team in the operating room for the transplant. This person was named Hamilton Naki, and a lot of debates would be raised regarding his role in the surgery. Hamilton Naki was born on June 26, 1926 in Nginsingain, Eastern Cape, South Africa. Not sure if I pronounced that right, but I did try. Raised in poverty, Naki left school at 14, subsequently working as a gardener at the University of Cape Town. In 1954, Dr. Robert Goetz, the professor of surgery, offered him a position in the lab where Naki started by cleaning cages, and eventually he was promoted to work in the lab, helping during the experiments on animals and quickly impressing Dr. Goetz with his skills. Naki would spend countless hours every day training and learning about surgeries. He gained so much experience, it got to a point he was able to take over the post-operative care of the animals and even do things like perform a whole liver transplant on a pig by himself. Many doctors described the way he mastered the surgical techniques put him on par with the highest levels of surgeons. And eventually, he himself would begin to start training the medical students at the school, going on to train hundreds of trainee heart surgeons and working at the hospital for almost 5 decades. Naki learned surgical techniques under Dr. Goetz and then later under Dr. Barnard, and both thought very highly of him, with Dr. Barnard even stating that he was, quote, one of the great researchers of all time in the field of heart transplants, and that he was, quote, a better craftsman than me, especially when it came to stitching. But as we discussed, Naki didn't have a formal certificate in medical education, and as mentioned, this was during the apartheid, so even if he wanted to, he would have been faced with a lot of restrictions and difficulty in doing this. This is where a lot of the controversy comes from, because during this case and even in Dr. Barnard's book, there were no mentions of Hamilton Naki, and in general, there was not a lot of recognition of him anywhere. But years later, especially following Naki's passing in 2005, many would speculate that Naki did in fact assist in the world's first transplant of a human heart. In fact, some would even allege that Naki was the one to do the majority of the work during the operation, considering Dr. Barnard himself admitted that Naki was a better craftsman than him. The problem for Dr. Barnard and the hospital, if this were to be the case, was that with this, not only was he not certified, but because of apartheid laws, Naki wouldn't have been allowed to even be inside the operating room, let alone touch a white patient. So if he were in the operating room, while this would be considered a criminal violation, many would argue this as an ethical violation as well. There would be a lot of debate about this. Many have stated this was false, explaining that the claims mentioned in major journals were from secondary sources. The Barnard brothers and some other staff would also adamantly deny that this happened, with them again reiterating that Naki did do great research, but that he didn't operate on patients. With apartheid laws gone after 1994, Naki was finally honored for the contributions he made towards the research, allowing this procedure to be possible. And this included receiving an honorary degree in medicine from the University of Cape Town. There's a lot to talk about on this topic, so this is definitely something I could look into covering in a whole separate video. But general takeaway, this definitely brought up some intriguing conversations, as others have brought up the point that even if he took part in it or not, Naki did do the training and did research that contributed to the team being able to perform the first human heart transplant, even when the apartheid laws were designed to prevent this. And this was just one of the many topics that were brought up in this case. A lot seemed to happen in the years following the heart transplant, and scandal or no scandal, many looked up to Dr. Barnard for his work and for being such a key pioneer in an extremely significant moment in history. Through his later years, Dr. Barnard would unfortunately suffer some health issues. In 1999, after having surgery, he made a full recovery after being diagnosed with carcinoma, a skin cancer on his nose. Just about 2 years later, on September 2nd, 2001, after swimming while on vacation in Paphos, Cyprus, Dr. Christiaan Barnard suffered an acute severe asthma attack, and he passed away at the age of 78. Methods and techniques to conduct heart transplant surgeries would evolve over the years, and survival rates would and still do continue to improve. In Louis' case, the aggressive attacks on his immune system proved fatal, while today we have more advanced medications and understandings of the immune system that can prevent things like that from happening. So far, the longest surviving person who's received a heart transplant is 58-year-old Bert Jansen from the Netherlands. Bert has survived 40 years after receiving the transplant on June 6, 1984. Also, a lot of the ideas involved in human-to-human heart transplants hadn't been officially considered in the legal sphere yet, so now there's definitely more changes to that. Listed on the University of Cape Town website is a team of 57 staff members credited for their involvement in getting this procedure done. It really is inspiring to hear about Louis' drive, even while going through so many health issues for so long, and hearing about how his family supported him throughout that time. It's touching to hear about Denise's family, especially her father, who gave consent for her heart and kidneys to be donated. And also can't forget about the initial family who consented to the donation as well. Dr. Barnard's drive to get down to the bottom of these procedures was definitely interesting to read about, especially with going abroad and coming back home, bringing the equipment and everything he learned with him. There's so much potential with these procedures, and it should be interesting to see how they continue to progress in the future. But yes, that is it for this case. What are your thoughts on Louis' story, Dr. Barnard's story, or just any of the topics involved in this case? Please comment your thoughts below, and don't forget to subscribe so you don't miss any other videos on medical cases, crime, and mysteries. Bye now.